For more on the coronavirus, let's welcome Dr. Devi Nampiaparampil. She is associate professor with NYU Langone Health, and thank you for being here today, doctor.
Oh, thank you.
So what are we seeing in New York City? I mean, people are looking not only at New York City, some of the other areas, Seattle, where you're looking at potential for more cases to come. But what do you know right now?
Well, there is some concern about community spread. There's a study that was done recently that showed genetic mapping. So it seems that maybe people are being exposed to coronavirus and not developing as serious of symptoms, and therefore other people are getting it. In New York City and in general, I don't think people have to be as alarmed. There seems to be a very low number of cases, relatively, only 100 or so confirmed cases. But of course, we have to be concerned.
How much of that is because we're not doing testing? There's a thread from a woman in Seattle who tried to go in and get testing done and basically was told, forget about it. And you've heard similar threads in Brooklyn and other places.
Sure. There are a couple of different concerns with the testing. I would say, first, the accuracy of the test. Now, we're hearing all these numbers, but we don't know if everyone is using the same test. If we think about other conditions, let's say HIV, cancer, we don't usually use one test. We do a screening test, and then we do a confirmatory test to make sure, the positives are positive and the negatives are negative, right? In this case, I think if we do more tests, we will see more positives. But when I think about, for example, South Korea, they're doing 10,000 cases per day or tests per day. Are all of those truly accurate results, right? So when they're seeing the large number of positives.
Well, wait a second. That's an even bigger concern. We keep thinking if we can get the testing ramped up and are really dealing with things, at least we'll have answers. You're suggesting we might not at that point?
Well, I think that the tests that the FDA and the CDC are using, the ones that are being looked at most closely, are probably accurate. But the ones that private companies are coming out with, when people rush to bring a test out, we have to compare it to see, are we actually identifying the new coronavirus? I mean, we have old coronavirus, which is the common cold everywhere. So you need to test people who are sick, which now there are larger numbers of people getting diagnosed, so you have to look at them. But you also have to look at people who are completely healthy to make sure those healthy people actually test negative with your test.
All right.
There are a lot of concerns.
That concerns me more than just about anything I've heard today, just because we talked with Dr. Scott Gottlieb earlier today, who said that the story on the New York Times is incorrect. There's not 1 million tests that are going to be able to be completed later. It's going to be more like 20,000 a day, maybe by the end of next week. But if you're telling me that the tests that we do end up running at that point, we can't even really feel all that confident in.
Well, I'm not saying that. I'm not that gloomy. I just think in general, principles of testing, we have what are called screening tests, right? Where a lot of people, we want to make sure everybody who could be positive is actually caught. But then we have confirmatory tests, which are much more strict and stringent. So just as a general principle, but I'm not doubting that the tests that we're using are accurate.
You said in New York City, no obvious reason for alarm given so far the incidence of cases. Are you seeing, are emergency rooms seeing an uptick of people kind of rushing in saying, maybe I have this? I mean, to what degree is it causing a little more attention on people who just have vague symptoms and things like that? I
think more people are getting concerned, but are they coming to the ER or are they staying home? That's the question. New York City, to me, looks like it's becoming a little bit quieter. I think people staying home makes more sense for many reasons. Aside from this new coronavirus, if people have symptoms and now we can text, we can call ahead, we can notify people beforehand. Think about measles, the flu. You don't necessarily want all these folks sitting in the ER and the waiting area of a primary care physician's office. Yeah. So I think we should take advantage of that.
They say that in Japan. That's the silver lining, that it's a bad flu season and more people are washing their hands more and not going to work, and it's actually helping with the flu season.
Exactly. One other thing in comparison to the flu, with this new coronavirus, we're not seeing as many kids being infected. So that's an area for study. Japan has closed its public schools, but not daycare centers. And even in China, where there's so many cases, you're not seeing as many among infants. That's a very small number. So
the question is if they transmit it to other people, if they're carriers for it.
That's a possibility, yes. But on the other hand, maybe it's an area where we can find some treatment.